Hi, this is Christine Crowell and thank you. Welcome to my channel. And today I want to talk to you about how you can build a journey around looking at the new healthcare technologies that you can introduce into your medical healthcare staffing business. Now, what am I talking about here? Now, you can quite easily get to 100k months by actually looking at the highest skilled healthcare professional and then providing them on a permanent basis and placing one or two staff members a month with a healthcare organization. And what do I mean by that? Now think about it. We got healthcare technology, and I'm not talking about nurses, I'm not talking about healthcare assistants. I'm talking about providing specialized doctors who are robotic surgeons, for example, and their yearly, for example, their yearly salary is say 300,000, for example, and you've charged a commission of say 30%. So what is three? I'll get my calculator out just so that you get yours out as well. Let's do this together. So switch your calculator on. 300,000, for example, and then you're doing 30%. That's $90,000 a month. That's placing one robotic surgeon a month permanently with an organization. I'll show you another example here. If you're looking at the temporary placement and you want to place a staff member temporarily in an organization as and when needed, ad hoc they call it. For example, you place the robotic surgeon into a specialist hospital, for example. Their rate is say, for example, 300, and I'm just saying this off the top of my head, 300 per hour, for example. You times that if they're going to do 12 hours. So that's 3,600 you would invoice for example, but they get half of that. Okay? So for example, you're charging 300, they would possibly get £200 per hour or $200 per hour. Depends where they are and where they're placed and where you are in the world, for example. So for example, if you did that times the 12, like I said, the day rate that you would be charging is 3,600. Times that by 7. This is just placing one staff member. A week you'd be charging 25,200 a week. On a temporary basis. Now you would quite easily get to keep a big chunk of that because you're providing specialized staff. So can you imagine? You're charging 3,600 a day for this specialized robotic surgeon. Just one. Do you know how many nurses or how many healthcare workers you would need to place a day in order to make that same amount of money? So let's look at that. 3,600 a day. That's 12 hours. 12-hour shift. If you was to look at placing a nurse and it's 85 per hour. You would need quite a lot of nurses for that 3,600. We was to say they're getting paid £85 an hour, like I said. It's a no-brainer. It's a no-brainer. Because each 12-hour shift, the nurse is getting, say, for example, you're charging 500 for the day, for example. If you're doing 3,600, you've got one person. Okay, that means you'd need seven people as opposed to one person making the same amount of money for your organization. Wouldn't that fit in better with your lifestyle? Would that not help you to have more time freedom? It would, wouldn't it? So then you're not working so hard to actually cover 7 staff members as opposed to 1 staff member. That 1 staff member is creating the same amount of money as what 7 nurses would be. If you was to even look down the route of healthcare workers, you're looking at placing more staff, which means more work for you, more stress for you. You're dealing with different skill sets, whereas one surgeon, you're getting the same amount of money. If you was to look at the permanent route, you're getting $90,000 a month. It's a no-brainer, right? So why are we not looking at placing healthcare professionals in highly skilled roles where it is not saturated, where it's a specialized skill? And technology today is the specialized skill. Healthcare technology, where you're placing specialized staff members at a higher rate because the need is great. The need is greater because they need that. And there's not many of them around. So why not you provide that type of healthcare professional? Why not become a specialized agency? Why not become a specialized medical staffing agency? Think about doing this today, because you're going to get left behind otherwise. We're all looking at nurse. I've been there, I've done it. You know, nurses, healthcare workers, hundreds and hundreds of staff members working really hard, doing 12-hour days, 16-hour days in my business. Because when you're doing rotas, rostering, you've got compliance, all of these things that you have to think about. Then you've got your team in your office as well as those out in the field. But if you just had one person that you had to think about, a couple of hours, 4 hours a day, that you place them once, permanently, once a month, that's $90,000 a month by placing one person a month. It's about working smarter, not harder. This is what 2024 is all about. We have to do that now. We have to look at working smarter and not harder. I just wanted to touch base with you. I wanted to introduce to you how you can bring in technology. You can provide healthcare excellence. And this is the way to do it, by providing a specialized skill. You can do this. And why should you not do this? Because this is how companies get to multiple 7 figures quicker and faster. They're even at 8 and 9 figures because they are providing highly specialized team members, staff to organizations on a permanent basis. So, what does excellence in healthcare mean to you? Did you get the answers about what I was saying? Did this video explain to you the importance of looking at the new? Well, it's not new. A lot of organizations are using it. The big, large organizations are doing this already. But look how this is going to be impacting our lives, patients' lives, and professionals alike. That's why I wanted to present to you today and highlight the industry and how you can look at accessing quality care by having higher costs, which is going to also help patient safety by you providing specialized staff members. I want you to explore this strategy by you providing technology and see what initiatives are out there. There's going to be initiatives and grants out there, but it's already been implemented and it is improving healthcare outcomes and it enhances the patient's experience. So I want you to really have a breakthrough moment where your healthcare organization is achieving significant improvement. You're helping to help patients to have a better outcome by providing specialized, highly skilled staff members. Like I said, it's about working smarter, not harder. So my conclusion to you is to look at the importance of improving and look at the collaborations that's happening within this industry already. If you want to learn more, if you want to join us in our boot camps, in our challenges that we hold, we also offer coaching, then book a free 15-minute consultation and I will gladly speak with you and go through it with you in greater detail. That's going to help you to benefit the community of where you live. So do like and subscribe. Join me in our Facebook group. Join us for our boot camps. We got our boot camps happening every month. I've got one starting tomorrow. But I hope that you can learn from this. And I just wanted to get you to think about what you can offer right now. And that's why I'm sharing this with you. It may seem shocking that I shared this with you, that people are actually charging and they're getting $90,000 a month. And I just wanted to bring this to your attention. We got to look at striving. We got to look at improving our service by providing a higher standard of excellence. Average is no good anymore. You got to be excellent. And this is what's going to impact our communities and professionals alike by collaborating and patience. So, like I said, think about your journey in your healthcare organization. Where do you want it to be? So, just some of the takeaways there. Look at this. You place one robotic surgeon, one a month, permanently, within a healthcare organization, and you charge 30% of their annual salary. So if their annual salary is, say, 300,000 and you charge 30%, that's 90,000, for example. Yeah, so let me do that again for you. 300,000, I've got my calculator out. Get your calculator out and do it with me. 300,000 times 30%, $90,000 a month by placing one specialized, highly skilled healthcare professional. It gives you something to think about, doesn't it? We got to build our lives around what we want, and then the business fits around our life, not the other way around. Too long we've been working too hard in our business and not working smarter. I've been there, I've done it, I've worn the t-shirt. But I want you to learn this blueprint, and I hope that you'll be able to book a free 15-minute consultation with me, and I will talk to you about the training program that we are starting next month. And I want you to be a part of that, because it is mind-blowing, and I want to share this with you because I'm so excited. This is how you can collapse time. This is how you can get to multiple 7 figures in a short space of time. And why should you not have that? We all deserve it. So do book a free 15-minute consultation with me. Like and subscribe to this video so that you can get further training, and I will do some more training anyway, like I always do. Join our Facebook group as well. Click the link in the comments here, and I look forward to seeing you or speaking to you online. Take care. Thank you. Goodbye.